Dengue is a mosquito-borne viral infection causing a severe flu-like illness that can sometimes develop into a potentially lethal complication called severe dengue. The Aedes mosquito, mainly Aedes aegypti, is the primary transmitter of the disease. Dengue is prevalent in tropical and subtropical regions around the world, especially in urban and semi-urban areas. Symptoms of dengue fever typically begin 3 to 14 days after infection. These may include a high fever, headache, vomiting, muscle and joint pains, and a distinctive skin rash. Severe dengue, also known as dengue hemorrhagic fever, can result in bleeding, low levels of blood platelets, and blood plasma leakage, or into dengue shock syndrome, where dangerously low blood pressure occurs. Prevention and control rely on reducing the habitat and the number of mosquitoes and limiting exposure to bites. Currently, there is no specific treatment for dengue, but early detection, access to proper medical care, and supportive treatments can significantly lower the risks of medical complications and death. Dengue fever spreads through the bite of an infected Aedes mosquito, primarily Aedes aegypti, which has adapted well to human environments. Unlike other mosquitoes, Aedes aegypti is a daytime feeder. Its peak biting periods are early in the morning and before dusk. When this mosquito bites a person infected with the dengue virus, it can then transmit the virus to another person it bites. The rapid urbanization and growth of cities in tropical countries have contributed significantly to the spread of dengue. Crowded living conditions, stagnant water in containers, and improper waste disposal create ideal breeding grounds for Aedes mosquitoes. Travel and trade have also played a crucial role in the geographic spread of both the virus and its mosquito vectors. People infected with the dengue virus can unwittingly carry to new areas when traveling. Climate change is another factor contributing to the spread of dengue, as warmer temperatures and changing rainfall patterns allow Aedes mosquitoes to survive and reproduce in regions previously inhospitable to them. Preventing the spread of dengue focuses on mosquito control measures, including eliminating standing water where mosquitoes breed, using mosquito repellents, and community-wide efforts to reduce mosquito populations. Dengue virus infection can lead to a spectrum of diseases, ranging from mild to severe. The primary disease caused by the virus is dengue fever, a flu-like illness that can affect infants, young children, and adults. Symptoms include high fever, severe headache, pain behind the eyes, joint and muscle pain, fatigue, nausea, vomiting, skin rash, and mild bleeding. However, the dengue virus can also cause more severe forms of disease, such as dengue hemorrhagic fever (DHF) and dengue shock syndrome (DSS). DHF is characterized by the leakage of blood plasma from blood vessels, bleeding from the nose and gums, liver enlargement, and circulatory system failure. These symptoms can escalate into DSS, a more severe form of DHF, leading to profound shock, massive bleeding, and even death. The severity of the disease can depend on several factors, including the strain of the virus, the age and health of the person infected, and whether they have been infected with the dengue virus before. Secondary infections with a different strain of the virus increase the risk of developing severe dengue. Treatment focuses on managing symptoms, as there's no specific cure for diseases caused by dengue. It's crucial to maintain hydration, rest, and medical supervision to manage symptoms effectively and prevent complications. Dengue fever is a mosquito-borne illness with symptoms that can vary from mild to severe. Early recognition of these signs is crucial for prompt treatment and recovery. Here are the common signs and symptoms of dengue fever. 1. High fever. A sudden, high fever that can reach up to 104°F is often the first sign of dengue. 2. Severe headache. An intense headache, especially behind the eyes, is a significant symptom. 3. Joint and muscle pain. Dengue is also known as breakbone fever due to the severe muscle and joint pains it causes. 4. Fatigue and weakness. Feelings of tiredness and weakness are common. 5. Skin rash. A few days after the fever begins, a rash may appear over most of the body. 6. Nausea and vomiting. Many people with dengue experience nausea and vomiting. 7. Mild bleeding. Mild bleeding such as nosebleed, gum bleeding, or easy bruising might occur. Severe dengue can develop after the initial symptoms, leading to more serious health issues such as bleeding, low levels of blood platelets, and blood plasma leakage. Warning signs of severe dengue include severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums, fatigue, restlessness, and blood in vomit or stool. If you or someone you know is experiencing these symptoms and has been in an area where dengue is known to occur, seek medical attention immediately for the proper support and treatment. Diagnosing dengue fever is crucial for timely treatment and recovery. The process involves evaluating the patient's symptoms and travel history, followed by specific laboratory tests. Here's how dengue is diagnosed. 1. Initial assessment. Doctors start with a physical examination, noting symptoms like fever, skin rash, and muscle pain. Understanding if the patient has recently traveled to or lives in a dengue endemic area can provide crucial clues. 2. Blood tests. The definitive diagnosis of dengue requires laboratory tests. These tests can detect the presence of the virus, antibodies produced in response to the infection, or the RNA of the virus. NS1 antigen test. This test can detect the virus early in the infection, usually within the first 5 days when symptoms are present. IgN and antibody tests. These tests look for antibodies to the virus. IgN antibodies are typically detectable 5 days after the onset of symptoms and indicate a recent infection, while antibodies appear later and can indicate a past infection or provide evidence of a secondary infection. PCR test. The polymerase chain reaction (PCR) test detects the genetic material of the dengue virus and can confirm the presence of the virus early in the infection. 3. Monitoring. In cases of severe dengue, further tests may be required to monitor complications such as blood platelet counts and to assess liver and heart health. Early and accurate diagnosis of dengue allows for appropriate management of the disease, helping to prevent severe complications and improve recovery outcomes. Dengue fever is more than just a simple mosquito bite's aftermath. While many recover without any lasting effects, the disease can escalate into severe complications for some. These complications include dengue hemorrhagic fever, marked by severe bleeding, sudden drop in blood platelets, and plasma leakage. Another critical condition it can lead to is dengue shock syndrome, characterized by dangerously low blood pressure. Understanding these complications is crucial in seeking timely medical attention and preventing the progression of the disease. Stay informed, stay protected. Protecting yourself and your community from dengue fever involves proactive steps to control mosquito populations and prevent mosquito bites. Regularly eliminate standing water in your environment where mosquitoes breed. Use mosquito repellents, wear long-sleeved shirts and long pants for added protection, and consider using mosquito nets and screens to keep mosquitoes away. Community-wide efforts, like fogging to kill adult mosquitoes, can also be crucial in areas with high dengue transmission rates. Remember, prevention is the best defense against dengue. Dealing with dengue fever centers on symptom management and supportive care, as there's no specific cure. It's crucial for patients to stay hydrated, rest, and take paracetamol for fever and pain relief. Avoid medicines like aspirin or ibuprofen, which could worsen bleeding complications. For severe cases, hospitalization may be necessary to closely monitor the patient and provide intravenous fluids and blood transfusions if needed. Remember, early detection and proper medical supervision are key to effectively managing dengue and preventing severe complications. We hope you found our video informative and helpful. Thank you for watching, and stay tuned for more updates. Your health and well-being are important to us. Remember, together, we can make a difference in the fight against dengue.